Hello everybody, it's Dr. Turpin. I want to give you an introduction to Adult Health 2. Hopefully this will be used in place of having to attend class on Tuesday, the first day of class, just because of room changes and how many different classes you have available. I felt like it might be easier just for you guys to have to listen to this review, and I will have an assignment to discuss with you towards the end that you will need to do before coming to class on Thursday. I will be available in the classroom on Tuesday morning or Tuesday at 11:30, just in case anybody really needs to meet with me. I will be there, but I thought this might make it smoother as we're going through so many transitions with classrooms and where they're located. Which brings me to, where is our class going to be? And that is a very moving target. In the beginning, we are slotted currently to be in the Plymouth Student Union in room 155, which is the Tater Hill room. And there is a good possibility that we may be moved from that classroom back to Edwin Duncan when a different department moves out of here before us. And so I'll just have to let you know as that unfolds whether we have an intermediary place. But for right now, we'll be in room 155 in Plymouth until further notice. Our slated classroom is supposed to be in the new Health Sciences building, room 220. And so at some point, probably midway or later in the semester, we will move on over there. And classrooms will open up and move much quicker than our offices will move. So right now I'm still in my same office in Edwin Duncan that I've been in. Once the classrooms move, I may well be, in a conference room or work mobily and kind of stay over there after classes, before or after classes, kind of in the new building. And later I'm supposed to move into room 514. But, the only reason I bring some of that up is whenever we're emailing or trying to set up times for meetings or test reviews or any of those kind of things, make sure that we're always being clear where we're going to meet at, because I hate for someone to be thinking that they're supposed to meet with me in maybe one place versus the other. So just know that we need to be pretty clear about that all semester just to stay on top of that. In terms of office hours, my office hours are somewhat limited, not because of my schedule, but because of how tight your schedule is. You all have clinicals going on at the same time in different locations and different days of the week. And then the Tuesday schedule is very tight for courses, boom, boom, boom. Thursday, there is a break from 1 to 3, so I'm happy to meet with anybody that needs to or whatever during that time frame, as well as on Mondays, and those will need to be by appointment. I do have a few meetings that I attend on Mondays for committees that I'm on, and so I'll just have to kind of let you know what I have available, but it's not like I'm in meetings all day on Monday. So there are plenty of times that I could set up that would probably work for my schedule as well as yours. So just make sure that if you do need a Monday meeting that you email me so we can get that straightened out. The textbook, we will continue to use our same Hoffman and Sullivan textbook, so you are getting a textbook that covers for 2 courses, which is good. The only difference is we will continue to use Davis and have assignments in Davis Advantage and Davis Edge, but we do have a different class code. So you will need to go on there and go to Davis and log in like you normally did, but you will need to kind of register in with this new class code, and that will take you to NUR3102 versus where you were going into 3100 for the other stuff. So just to be clear, you've got to go in there and kind of register yourself in for the new course. using a different code. And then you will be able to see that information. And I suggest you do that today, if at all possible, on Tuesday when you're listening to this, because I know that there is a pre-assignment before Tuesday's class that you'll need to kind of get ahead on and get done. In terms of content areas, this is just a sampling of some of the things that we're going to cover, but you'll see that very clearly in the outline for the course in As You Learn, and also in the course schedule. I've tried to keep those mapped out similarly how we had them for last semester, but just know that we will have a few guest speakers that are coming in this semester for a couple or more topics, and so there could be some things that are still rearranged around a little bit based on that. And we will mostly hit all new chapters. We may have a little remediation on a couple of topics. I do know that we probably have talked a little bit about aging already in general, but we will cover some more things with diabetes yet again, because if you remember, we went over kind of the basics with diabetes, and then for this semester we will go over like DKA and HHNS and a little bit higher level conditions in diabetes. But we'll also do all of endocrine and all of the nervous system, and several different things that are listed here as well as in your course schedule. In terms of graded assignments, you're going to have pre-quizzes, 4 of those that were in Davis Edge, just like you had before. Those count for 5% of your grade. We're going to have 4 solid exams that will be 15% each, and you're going to have application exercises or activities, 4 of those that are worth 2.5% each, or 10% total, and those you can kind of see already outlined in As You Learn. We will be actually going ahead and knocking out one of those on this Thursday, and because you have this chronic disease case study towards the end, I want to get at least a couple of your application activities done earlier in the course than we did for 3100. So you have plenty of time to work on this case study, and I'll tell you a few things about it, but then we'll go over it in class again at a later time. And then your final exam counts 20%. This is just a couple of slides that give you some outlines of the chronic disease case study. You're going to develop a case study, and then you're literally going to portray and be that patient in a setting that kind of mimics like you're a patient laying in a hospital bed. So the key will be to really kind of be thinking about a specific chronic disease covered in Adult Health 1 or 2 that really interests you, or one maybe that you have trouble understanding and you'd like to investigate it further. Sometimes that helps you learn more. So a lot of people will choose a disease that just baffles them, or they've had a hard time understanding, because this gives you a really solid way to kind of dig in deep on something and get it down. So think about that. How do you want to do that? And remember, it's a chronic disease. So, we talked about UTI last semester, but UTIs can be acute and not a chronic ongoing disease for patients. So it's not every disease that we covered, but chronic diseases. You're going to interview a patient with that disease to gather more data besides what the textbook might tell you. Some people could look up things online of patients that tell about their disease to also find more information. You might find that you had a patient in clinical last semester where you have all their care plan and all their data and things and you could use one from some of that kind of information to make this case study. So, use the resources you have to try to get the most interesting thing, because you're going to be portraying this patient, so you want to make it interesting, kind of detailed, give you some idea about the person. And you're going to be portraying this patient for each other. So half of the class is going to be portraying patients one day, and the other half of the class that day will be being nurses that are coming to interview them and see if they can find out what's wrong with them. Then that will flip, and the next time those that were being the nurses will flip and become their patients, and vice versa. So that's kind of how it will work. For the case study, you can kind of see, go in there and look at the actual file that's in the As You Learn course, and you will see templates of every kind of report, every kind of form that you might need to really show this about your patient. And then you're also going to create an algorithm that shows a change in condition scenario. And for those of you who are not, I think we've looked at some algorithms from like ACLS or guidelines of like, when this happens, then you do that, and this occurs, then you do that. But that will be kind of like a one-page trigger thing for you and for me as the person in there kind of seeing how this is going. You want to depict, here's this change of condition and here's what happened with the patient. And if, this one thing happens and the nurse does one thing correctly and gives the right actions, orders, responses, then they usually improve. If the nurse doesn't recognize the condition or goes and does an inaccurate kind of order or response, then usually the condition deteriorates further. So, play with this and kind of think about with your patient and this chronic disease, what's a normal complication? We go over those in class all the time. What are the complications? So, those are fairly easy to determine. And then, how would that be treated if that complication occurred? And if that wasn't treated that way, how would it worsen? But anyway, you've got samples of all this. You will need to prepare a list of supplies, and I'll give you a date later on. But as you can imagine, the person that's going to be manning the lab that is going to give you some things to, an IV to tape on your arm or whatever to look realistic, you're going to need to, have that list available so that Miss Dawson or whoever else is going to be working on getting these things together has enough time to get it together for all of you guys, because it's a big class. And this is kind of like what you imagine, you're in there physically being the patient and somebody's in there interviewing you. Do note that there's two groups. You'll get set up in two different groups. Half the class will be portraying a patient on one day and and the other half being caregivers, and then it'll flip in the other half of the class. So I will be kind of putting you in group 1 or 2. If you have a preference, let me know as you're getting closer to that. And your grading is going to be based on how did you prepare the case study content, half of it, and then the other half is on how did you actually portray the patient, or how did you portray being a nurse in the situation. Testing, the only thing I want to mention about this is when we move to the new building, the college is going to have laptops available, and when I can be reasonably assured that we're going to have access to those, you will not have to be bringing your own individual laptop for test. The other thing is for remediation on exams, we need to try to get those done within 2 weeks of the exam, and with us being back and forth in different buildings, that could be more difficult. So I will try to be getting in touch with people immediately after we have exams if they need remediation, so that we can try to work out something in a ready manner. And certainly email me if you have additional needs to do any test reviews. I do want to mention for ATI, we will still be doing that. This is your information regarding that. We already kind of have a plan for how to do a retake exam, and you'll see on your course schedule when the ATI is scheduled. Again, if there's changes in the course syllabus or schedule, I'll be making those aware of those. And then just for your assignment for Thursday, you do have a quiz in there that will be due by Thursday at 11:30. So just make sure that you're going ahead and getting that accomplished. And this is just some details on that. And I look forward to the semester.